So, continuing on in part two of what I would call rational skepticism in medicine. Part one, I talked about the issues I have with formal medicine, is that there is bias from money introduced into the study. And that's not to say to discount it, but to be rationally skeptical about it. So, the issue then I have with I don't know how integrative medicine, but they're more basic offshoots of holistic medicine or Eastern medicine and so on, is the too heavy reliance on anecdotal experience. And we see presented by a number of people, perhaps of people who are somehow celebrities in something, then saying, well, they did this and they have cured themselves of cancer, whatever. Or other people we see, that they were praying and it cured them of cancer. So one of the things that I learned early on with publishing textbooks is that on MRI of the abdomen, my earliest textbooks, I got very excited about, writing out about exceptions, about anecdotes of cases that were different than how normally hepatocellular carcinoma or metastases look like, etc. So the problem with that, though, is that at some level, then you could reduce it to anything can look like anything. And that is, at the other extreme, a huge mistake. So after about the third time of writing a book on MRI of the abdomen, I stopped writing about anecdotes, but focused really on the numbers, the big numbers. So when I approach medicine, so for instance, when I hear, an anecdote of somebody drinking green tea and praying and got over cancer or whatever, I think, well, that's interesting. That may be, maybe in part, it may be in some people the ability of the cognitive mind to activate the immune system. And I don't discount that that can happen with people, but at this point in time, not reliably. So oftentimes, those kind of things that they may be doing, I take to mean, hey, this is worth adding into a formal medical approach to a disease entity. Maybe you should be doing things like meditation. Maybe you should be doing things like yoga or Tai Chi. For instance, the cold drink that I try to drink all the time is black tea, and some of that is because it contains theophylline, which turns out to be very effective with many autoimmune type conditions, which includes gadolinium deposition disease, but basically all of them. So it's cheap, it's easy to do, and I actually like it. But the important thing is that I don't sweeten it. So even though I live in the South, I do not sweeten the iced tea. I drink it black. And again, the difference between coffee, which is also a beverage that's associated with a number of health benefits, is that with coffee, I always have to sweeten it and put milk in it, whereas tea, I can drink it black. So between the two of them, since it's good not to have too much refined sugar, I drink black tea. Green tea would also be good to take as your routine beverage, and maybe for treats then, rather than all the time, which I historically had done with Diet Coke. Maybe it's just the odd treat you have once a week. So I also get to the point is that if you're too stressed out on doing always the right thing in eating and drinking stuff, that stress is actually contributing more to ill health than probably letting loose with eating various things. We'll cycle back and discuss these kind of issues again repeatedly, because these are things that need to be repeated. So the problem I have with integrative health is they focus too much on anecdotes. And, I see an anecdote and I think, geez, that's interesting and great. But what I really want to see is large numbers. An anecdote is nice, but I'm very skeptical about anecdotes, and I want to see large numbers. And again, on a dark humor, and unfortunately, most of these things we have to have a dark humor with it, is that I recall, and this is now an issue with formal medicine use of an anecdote, but cancer centers on TV, where a cancer center was advertising, having a female patient advertise that they went to cancer center and things were great. But what she illustrated is that she said the cancer center told her she didn't have pancreatic cancer, but autoimmune pancreatitis. So somebody who knows a great deal about medicine, I thought, well, wait a minute here. Basically, what you're saying is that you had the wrong diagnosis. And that observation using medical, an example of formal medicine, sort of, I think they stopped showing it because they realized, hey, this isn't really talking about cancer care. It's talking about she had the wrong diagnosis. And that's all too often done in everything in medicine. But that's the issue that I have with integrative medicine and holistic medicine. When they talk about somebody curing themselves from something, I have to ask myself, well, do they actually have that lesion? So another very good example of that, now again comparing formal medicine and integrative, is that it's not uncommon to hear a patient, for instance, who says, well, I had a total prostatectomy for prostate cancer and I'm disease free and I'm so happy I did that, and this was a thing I should have done and everybody should do. Again, I step back and say, hey, wait a minute here. Just because your anecdote said that total prostatectomy cured your cancer, that's not a large trial of patients. Maybe most people do perfectly fine if they have no surgery at all, because most prostate cancers are the tumor that, is in the colloquial medical expression for it is that most people die with prostate cancer and not from prostate cancer who have prostate cancer. So again, it's a concept of wisdom. Yes, I listen to anecdotes, but then I think into it. So I also want to illustrate, and I would use this example with teaching my international group of scholars who would come and train with me in body MRI at UNC. I use the example of what's called historically pseudotumor, but which is in fact the formal pathological term inflammatory myofibroblastic tumor. And this is a tumor that can look like cancer, but it's benign, and it oftentimes goes away eventually on its own. And it's some sort of an immune reaction to cells that the body can calm down on its own. So these are historically called pseudotumors, and by the term myofibro, that means myo is muscle and fibrous, but there are a number of different of these sort of immune reactions that many oftentimes self-resolve. So I oftentimes wonder when people say they had cancer and then they did this, whatever, and now they don't have cancer anymore. I always think to myself, hey, maybe they have inflammatory myofibroblastic tumor. I also use the same sort of rationale when people, again, in the community of gadolinium deposition disease, say, well, there's this patient who had chelation and then they died. I always say, well, these are complex stories. I would have to research into this to figure out why this patient died. There is a number of variables, and each of these sort of exceptions to how, I practice treating patients with gadolinium deposition disease, there's a story to it, which would involve a lot of research. But the issue that I have in these stories is I say, I'm spending a lot of time treating patients with disease and in the best way possible. I don't have time to investigate why at other centers or elsewhere things went wrong, because there's a number of factors that why it went wrong, which would take hours of time. And I am spending hours of time each day actually answering emails from people around the world with gadolinium deposition disease and reaching out to me in a desperate state. So I have to pay attention. And again, this also refers to management of time, which you have to do yourselves in your healthcare stewardship. So in this session, I talked about the issues with integrative medicine and too heavy reliance on anecdotes. So I like anecdotes, but I always want to see large numbers of patients. Thank you for your attention.